The digestive system is a group of organs that work together to break down food into nutrients your body can absorb. First, it breaks down food. Your mouth, stomach, and intestines work together to mechanically and chemically break down the food you eat. Second, it absorbs nutrients. Once food is broken down, your small intestine absorbs the nutrients your body needs. And the last one is, it eliminates waste. Any leftover that your body doesn't need is eliminated as waste through your large intestine. Mouth. It is where food enters the body and begins to be broken down. Esophagus. A tube that connects the mouth to the stomach. And then the stomach. A muscular organ that churns food and mixes it with acids and enzymes. Small intestine. The longest part of the digestive system where most nutrient absorption occurs. Large intestine, the final part of the digestive system where water is absorbed and waste is formed. We have liver. It produces bile which helps break down fats. Pancreas. It produces enzymes that help break down carbohydrates, fats, and proteins. Gallbladder. It stores bile produced by the liver.
Hemorrhoids. Hemorrhoids, also called piles, are swollen and veins in the anus and lower rectum. Hemorrhoids are similar to varicose veins. Hemorrhoids can develop inside the rectum, called internal hemorrhoids. They also develop under the skin around the anus, called external hemorrhoids. Internal hemorrhoids. Internal hemorrhoids lie inside the rectum. You usually can see or feel them, and they rarely cause discomfort. But straining or irritation when passing to stool can cause painless bleeding during bowel movements. You might notice small amounts of red blood on your toilet tissue or in the toilet. A hemorrhoid to push through the anal opening, called a prolapse or protruding hemorrhoid. This may result in pain and irritation. External hemorrhoids. They are under the skin around the anus. Symptoms might include itching or irritation in the anal region, pain or discomfort, swelling around the anus, bleeding. Thrombus hemorrhoids. Blood can pool in an external hemorrhoid and form a clot, called a thrombus. A thrombus hemorrhoid can result in severe pain, swelling, inflammation, hard and discolored lump near the anus.
Causes of hemorrhoids are being overweight, lifting heavy objects, constipation or diarrhea, sitting on the toilet too long or pushing too hard while passing stool, and sometimes anal sex. Treatment for the symptoms. You can use stool softeners, laxative if you are constipated, numbing cream, sitting in a tub of just enough warm water to cover your anus, or you can call it a sitz bath. So, how to prevent hemorrhoids? Hemorrhoids are common as you get older. So, here are some tips to prevent hemorrhoids. Don't sit too long or push too hard on the toilet. Go to the toilet when the urge hits. Don't delay bowel movements. Drink plenty of water throughout the day. Eat more fiber foods. Exercise and keep your anus clean. Don't take too many laxative or enemas, can make it hard for your body to regulate how you poop.
Appendicitis is an inflammation of your appendix. It's the most common cause of acute abdominal pain requiring surgery. Untreated, it can lead to serious complications such as peritonitis or an abscess. Symptoms of appendicitis: abdominal pain, nausea, and lost appetite, swollen belly, diarrhea. Causes of appendicitis are hardened poop, hard, calcified fecal deposits known as fecalites, appendicolites, or appendix stones can get stuck in the opening to your appendix. They carry bacteria and can also trap bacteria that was already there inside in your appendix. Lymphoid hyperplasia. Your lymphatic system which is part of your immune system, help fight infection by producing and releasing white blood cells into your tissues. This can cause the lymphoid tissue in your appendix to swell even the original infection is elsewhere in your body. The swollen tissue in your appendix can obstruct it and lead to infection inside. Colitis, inflammation in your colon from an infection or inflammatory bowel disease can affect your appendix. The infection may spread or the inflammation itself may irritate it. Well, there's no guaranteed way to prevent appendicitis entirely, but there are several things that you can do to potentially reduce the risk of developing appendicitis. High fiber diet. A diet rich in fiber is considered the most effective way to lower the risk of appendicitis. Staying hydrated. Drinking enough water is crucial for proper digestion and bowel function. Fenugreek seeds. Fenugreek seeds have anti-inflammatory properties and have been traditionally used to prevent mucus formation around the appendix. Regular exercise. Good hygiene. Washing your hands frequently with soap and water, especially before eating or preparing food. Avoid smoking. Smoking has been linked to an increased risk of appendicitis. The toxin in cigarettes can impair the digestive function and weaken the immune system.
Treatment for appendicitis. Doctor typically treat appendicitis with antibiotics and with surgery to remove the appendix either by laparoscopic surgery or laparotomy. From surgery decrease your chances of a burst appendix. Doctor uses special care for treating a burst appendix, abscess, or peritonitis. Some mild cases of appendicitis may be treated with antibiotics alone.
Colon cancer. Colon cancer, also known as a colorectal cancer, is a type of cancer that begins in the colon or rectum. These are the last parts of the digestive system, responsible for absorbing water and eliminating waste from the body.
How colon cancer develops. Most colon cancer starts as a small, non-cancerous growth called polyps. These polyps can slowly develop into cancer over time, often taking several years. While most polyps are benign, sometimes like adenomas are considered precancerous and most a higher risk of turning into a cancer. Stages of colon cancer. Colon cancer is staged based on how far the cancer has spread. Stage 0. Cancer is only in the innermost layer of the colon lining. Stage 1. Cancer has grown into the wall of the colon but hasn't spread beyond the muscular cuff or into nervy lymph nodes. Stage 2. Cancer has spread farther into the wall of the colon but hasn't spread to nervy lymph nodes. Stage 3. Cancer has spread to the lymph nodes. Stage 4. Cancer has spread to the other organs such as the liver or the lungs.
Symptoms of colon cancer. Many people with colon cancer don't have symptoms in the early stages, but symptoms do appear. They can include changes in bowel habits, such as more frequent diarrhea or constipation, rectal bleeding or blood in the stool, ongoing discomfort in belly area, such as cramps, gas, or pain. A feeling that the bowel doesn't empty all the way during a bowel movement, weaknesses or tiredness, losing weight without trying.
Doctors are uncertain what causes most colon cancer. Colon cancer happens when cells in the colon develop changes in their DNA. A cell's DNA holds the instructions that tell the cells what to do. The change tell the cells to multiply quickly. The changes let the cells continue living with healthy cells die as part of their natural life cycle. This causes too many cells. The cells might form a mass called a tumor. The cells can invade and destroy healthy body tissue. In the time, the cells can break away and spread to other parts of the body. When cancer spreads, it's called metastatic cancer. While colon cancer cannot be entirely prevented, several strategies can significantly reduce your risk. Regularly screening. Colon cancer screening is crucial for early detection and prevention. It involves tests that can identify precancerous polyps or early stages cancer. Healthy diet. A diet rich in fruits, vegetables, and whole grains with limited red and processed meats can help reduce your risk. Regular exercise. Physical activity can help reduce your risk. Maintain a healthy weight. Obesity is a significant risk factor for colon cancer. Losing even a small amount of weight can reduce your risk. Avoid smoking. Smoking significantly increases the risk of colon cancer. And lastly, the limit alcohol consumption. Excessive alcohol consumption is linked to an increased risk of colon cancer.